So if you've been outside, you may have noticed a hazy and smoky sky. That's because smoke from those wildfires in eastern Canada have moved south. At least 16 states have issued air quality advisories. Good air quality ranges from 0 to 50. Right now, cities in Mississippi and Alabama are seeing those numbers in the 80s and 90s, making it a moderate quality. Our Grace Brister is outside the studio. So Grace, tell us, are you feeling any relief?
Andrea, we're used to this muggy air, but there's still not a lot of relief out here. And if you stay out here too long, it could be harmful to your health. The smoky air has made its way to the south, and Dr. Harry Holliday, pulmonologist at OCH Regional Medical Center, says it can do more than just put a hazy blanket in the sky.
For the short term, it can cause exacerbations of underlying lung problems, and even studies show that it increases the hospitalization of people with heart disease, kidney disease, diabetes. So it's something we want to be aware of and maybe take precautions during this time.
Dr. Holliday recommends limiting your time outside, especially if you have underlying health conditions.
Especially the wildfires, there's more inflammatory particulates in the air, and that can even be worse than kind of your routine air pollution in bigger cities. So for that reason, I would recommend just precautions if you have underlying problems, being indoors more. And even if you're healthy, exercising and the air pollution can actually cause more exposure, because when you exercise, you're going to be breathing more air in and out and getting more particulates in your lungs. So even outdoor exercise, I would say try to reduce at least, till the air quality gets a little better around here.
WCBI meteorologist Ashley Bryant says the timing of how fast the smoke can move out is uncertain.
So on top of all of that fire, then we have the higher level atmospheric winds, and that's kind of dragging it from Canada down south to where we are. It's going to be iffy on timing, but if wind patterns change, then of course that would allow it to move out just a little bit quicker.
Just remember, if you have underlying health problems, that you may get flare-ups. Be sure to use all of your medications. Asthma patients, take your routine medications. If you're having a little more trouble, take your rescue inhalers if you need to, and just be aware if you're having a lot more problems, see a doctor, or if you're really having severe problems, go to the emergency room.
Dr. Holliday says that children exposed to poor air quality for long periods of time have a greater chance of developing asthma or cardiovascular disease. So stay indoors and take it easy if you can. Reporting live, Grace Brister, WCBI News.